Adequate and Affordable Housing by Mandy Carrillo, Jean McBee, and Trifine Bulape Michambo. Our group researched adequate and affordable housing. We learned the impacts of not having adequate housing and the struggles of obtaining affordable housing. We learned that there is not enough low-income housing in Idaho, and that the length of time after applying to Section 8 or SECA can take years to obtain housing. The cost of housing in Idaho has risen over 200%. Idaho was ill-prepared to deal with the housing shortage and the higher prices. This has also caused a labor shortage. The minimum wage in Idaho is still $7.25 per hour, but most low-paying jobs start out between $12 to $14 per hour to gain and retain employees. This, coupled with rising food prices, makes affordability of housing even more out of reach. Since 2008, more people have dropped into poverty, and housing subsidies have remained the same. The average housing costs in Idaho are $762 to $1,776 per month, which would make it almost impossible to cover the cost of housing, making $7.25 an hour at 40 hours per week. The gross pay would be $1,160 per month, and this does not include utilities, groceries, gas, and everything else needed to keep a household healthy. This graph shows the way students in Idaho are living. Most are doubled up with other families because the cost of housing is so high. 634 have unknown living situations, and most likely these numbers have already changed for the worse. Adequate housing is important because the quality of housing can lead to health problems if there is mold, pests, lead, improper heating and cooling, and any other conditions that could impact an individual's health. Stability is important so people can avoid being evicted or having a foreclosure, and in general to prevent homelessness. Affordability is important to make sure individuals are able to make their payments on their mortgage or rent and not fall behind. The neighborhood should have good schools, access to transportation, job opportunities, and have good community supports. These are basic public health needs for all people. This graph shows the number of homeless students we have in Idaho, which has only decreased minimally between 2019 through 2021 and will continue to increase without affordable housing. Children are greatly impacted by not having stable housing, and it affects them mentally, emotionally, and physically. The Obama administration furthered the Fair Housing Act, which has established mandates that help reduce segregation and help promote health equity. This should help with the impacts that inadequate housing has on children. Idaho made a fund to help with housing in 1992, but it has never been used because there has not been money put into it for the federal government to match funds with. The Emergency Rental Assistance Program ended this November, according to YCAP. There is also a policy to ensure adequate and safe housing for Idaho citizens. Idaho continues to have a housing authority to help house people in safe, affordable dwellings. What could be done with policy changes? We could use the 4 C's of healthy housing. 1. Cost, or affordable housing. 2. Conditions, or the quality of the housing. 3. Consistency, or residential stability. And 4. Context, or neighborhood opportunity, by Swope and Hernandez, 2019. Inclusionary housing is a step in the right direction, making houses and rentals more affordable as the developers are still building to keep up with the housing demand. In 2019, the housing supply was almost 20,000 houses short. Having inclusionary housing helps keep affordable housing built into the equation and can help offset some of the housing problems people are experiencing. Inclusionary housing involves developers giving back to the community by making 10 to 30% of their development affordable for people of low income. This can be done by lower rent apartments or making condominiums, apartments, and homes more affordable for the lower income population. There's not one conclusive answer to the housing problem. There will be unhappy people no matter what avenue a person chooses to remedy adequate housing. Idaho had created a trust fund but was never able to get funds in it to get the matching funds from the government because the opposition to extra real estate taxes was so strong. We also learned that children need adequate housing if they are going to learn and thrive. Social workers can help with affordable housing on both micro and macro levels. They can help people sign up for services to keep them with a roof over their head. They can also help on a governmental level by writing policy briefs and standing up for people that need help with housing. Our solution to the adequate and affordable housing crisis was both on an individual level and a policy level. We felt that children need a strong and supportive safety net in place to give them the tools they need to grow up to be healthy adults. This will require policy changes of a wider net of Medicaid and food stamps, as well as more Section 8 housing through SECA. The real estate taxes will need to be put in place to fund the legislative bill 678101 to fund housing. All the money that has poured into the Treasure Valley could easily spare a portion to help those in need. We also feel that the developers of housing subdivisions and apartments need to mandatorily make 30% of what they build be inclusionary housing. This should help alleviate the high numbers of people who do not have adequate housing and help with city funds on the enforcement of people living in trailers and subdivisions. It can also help with people who are living in campgrounds be able to afford a house or an apartment again. Thank you for viewing our presentation. It would not have been possible without the references our group utilized.